Bringing another life into this world is one of the most special moments in a woman's life. From the time you find out to the baby's first kick, all the way to holding your newborn in your arms, they're all so very special. That's why getting care before, during, and after pregnancy are very important. Not only will it keep you healthy, it will give your growing baby the best start in life. I'm Dr. Freddy Gomez. MedTalk Health Talk is your connection to healthcare. Maternal health is critical to a mother's physical and emotional well-being. To join us with today's discussion, let's welcome Dr. Nonette Jiansuy. She's a perinatologist from the Good Samaritan Medical Center. We're also joined by Dr. Irene Sige. She's an obstetrician and gynecologist and sonologist from the St. Luke's Medical Center at the Global City. Thank you both for joining us in this episode. Maternal health is all about a woman's health and well-being during pregnancy, childbirth, and the postnatal period. And each stage could ensure that the health and well-being of both the mother and the child are given priority. Now, Dr. Irene, can you explain to us why this is so important, especially for those who are having their child for the first time?
So it is important that even the period before pregnancy is very significant. So we need to provide them with the utmost care. We need to identify the current status of the mommy, if she's healthy, if she's doing the exercise, and if she has other complications in her previous pregnancies.
Okay, so marami talagang factors involved, ano? So it's best that you have a OB or a doctor with you in every step of the way. Now, every woman reacts differently to being pregnant, and pregnancy changes your body, which can also affect how you feel. Dr. Nonette, can you give us an overview of what to expect in the first few months of pregnancy?
So the first symptom would be missed menses or amenorrhea. This will be followed by the feeling of bloatedness, nausea, or vomiting. There are also other physiologic changes related to the hormonal changes in pregnancy, such as skin changes. Most pregnant women would be bothered by the hyperpigmentation in their armpits or the presence of hyperpigmentation in your face. There are also other more pressing symptoms such as heartburn, weight gain, and they become actually more anxious because of these pregnancy changes.
But one change actually that maybe a lot of people are familiar with is that of yung tinatawag na morning sickness, which is common during pregnancy. Now, it may happen, it may not happen, but despite its name, it can happen at any time of the day. And this can sometimes cause a loss of appetite, and some women worry that this may affect their babies. Dr. Nonette, why does this happen? And can mothers do something to prevent this or compensate for this?
Yes, morning sickness or nausea and vomiting usually happens because of the overabundance of your beta-HCG or the beta-human chorionic gonadotropins. This is the hormone produced by your placenta and ovaries during pregnancy. So what happens is that the increase in beta-HCG produces your nausea and vomiting. Sometimes it becomes too severe, which can lead to dehydration and electrolyte imbalances. So treatment is usually just supportive. We advise them to take small frequent feedings. There are evidences also that vitamin B6 can help alleviate the symptoms. Ginger or your ginger teas, ginger candies can also help decrease the nausea. But again, treatment is really just supportive.
Now, I'd like to talk about something else, and that is folic acid, which is a napaka-importanting vitamin that your doctor will recommend once you find out that you're expecting. But it's also recommended to those who are looking to conceive. Dr. Irene, let's explain what folic acid is and how can it actually help a mother and her baby.
It is recommended that folic acid be given to those women who are even just planning to get pregnant, at least 1 or 3 to 6 months prior to conception, because this folic acid will prevent the development of congenital anomalies of the fetal brain.
Prenatal care is actually key in a healthy pregnancy, which means that you have to see your doctor, your OB, on a regular basis. Dr. Irene, we want to talk about what the doctor is checking and monitoring during these checkups, and how often ba dapat nagpapa-check up?
The moment you notice the symptoms of pregnancy, as mentioned by Dr. Nonette, you already consult your family doctor or an OB/GYN. During the prenatal checkup, your complete medical history and physical examination will be done. We can review all your medical history, your possible comorbidities, previous histories of infection.
Many conditions can actually potentially lead to complications during pregnancy, which can affect the health of the mother and the baby. Dr. Nanette, what are some of the common complications, especially here in the Philippines, that can affect a woman's pregnancy?
So number one, the most common really is symptomatic bacteriuria or your urinary tract infection. Other common complications include your vaginal infections that can lead to preterm labor. Also, among Filipino women, we have hypertension and diabetes mellitus.
Because high blood pressure before and during pregnancy puts a woman and her baby at risk for several problems. Dr. Nanette, what should a potential mother do if she's hypertensive while pregnant?
So if the patient is hypertensive during pregnancy, number one is we have to control the blood pressure. You have to consult with your obstetrician for appropriate treatment. There are only a limited number of antihypertensive medications safe for pregnancy. Second is you really have to do BP monitoring at home. We have to educate our patients on what to watch out for the hypertensive complications and regular and frequent maternal and fetal surveillance to check for any complications in the fetus.
Yes, and one of the conditions also that your doctor will closely monitor is the possibility of your blood sugar being not properly regulated, which can negatively affect a mother and the baby's health. Now, Dr. Nanette, for someone who's never heard of gestational diabetes before, ano ba ito and how does this affect one's pregnancy?
Okay, so diabetes mellitus can occur because of the physiologic changes in pregnancy. We have an increase in insulin resistance and carbohydrate metabolism, which predisposes a woman to an elevated blood sugar. So at the onset of pregnancy, we have to screen all pregnant women for fasting blood sugar. Diabetes during pregnancy can affect the mother through elevated blood pressure, increase in weight gain. Postnatally, if there is uncontrolled blood sugar, the baby can present with postnatal hypoglycemia.
Knowledge and proper preparation for childbirth are very important. When we come back, we'll talk about how to ready your mind and body for childbirth. Stay with us. We're together in health. Knowledge is important to make informed decisions during pregnancy and childbirth. But too much information can be overwhelming and can even cause anxiety. I'm Dr. Freddy Gomez. You're watching MedTalk Health Talk on CNN Philippines. We're here to build a healthier future for you. Every woman's labor experience is unique. Some may occur in just hours, but others may test a mother's emotional as well as physical stamina. Dr. Nonette, how can one prepare for labor and promote overall comfort?
Preparation for labor involves a holistic approach, not just preparing the mother physically, but also preparing both the mother and the husband physically, mentally, emotionally, and psychologically, because it is a very long process, and especially for first-time mothers, they are really more anxious and they really have fear of the unknown. So we just have to walk them through and assure them that they are safe while doing their labor, that their OB will always be there beside her.
Now, when it comes to giving birth, how can you decide which is better for you? A natural birth or CS or a cesarean delivery? Dr. Irene, pwede bang pumili ang isang mother kung gusto niyang natural birth or kung gusto niyang magpa-cesarean section?
What happens is during the prenatal checkup, we already identify the risk factors for the mothers by doing the necessary test and the ultrasound. Now, there are cases where an outright cesarean section can be done, especially if there are cases of placenta previa. But the goal is to choose the safest delivery for the mother and the baby. So you really cannot choose if it's a normal delivery or a cesarean section unless there is an absolute indication for a scheduled cesarean section.
It's no secret that delivering a baby can be very painful. And that's why there's such a thing as an epidural injection to minimize that pain. Dr. Nonette, we want to explain this when it is administered. Are there indications where an epidural is better for the mother?
Epidural anesthesia is what is commonly known to our patients as painless anesthesia. So we usually administer this for patients with medical indications such as patients with hypertension, patients with heart conditions that needs a decrease in their pain tolerance or pain threshold, which can significantly affect or elevate their blood pressure and heart rate.
And expectant mothers are taught also in prenatal classes breathing techniques naman to help during labor. Dr. Irene, how can breathing help manage the pain or distress for mothers who are in labor?
When you have the proper breathing techniques, it can relax the mother. It can give her a proper perspective on the labor course and on the delivery. So basically, it's about conditioning the mom to have a positive experience during labor.
Now, if you're expecting or just recently had a baby, you may have concerns on the impact of COVID-19 on you and your baby. Dr. Irene, what are some of the risks of COVID-19 during and after pregnancy?
According to the World Health Organization and to the guidelines on the infectious disease in OBGYN, the mother has the same risk as the general population, but she has an increased risk in having a more severe type of COVID-19. So the best thing also is to, at this time, have yourself vaccinated against COVID-19, plus exercise the health protocols that we've been doing ever since the pandemic set in, like the proper wearing of medical grade mask for pregnant moms, the hand washing, physical distancing, keeping yourself healthy, and you try to avoid going out if it's not important. The best is to consult your doctor for any signs and symptoms of COVID-19 and have yourself vaccinated. It is safe. It is safe to have a vaccination after the first trimester. So second trimester and beyond, you can get your COVID vaccine.
Okay, you bring up a very good point na it is safe to be vaccinated with any vaccine ba ito, Dr. Irene? Are all COVID-19 vaccines safe for pregnant women basta after the first trimester?
Yes, the recent guidelines said that this is basically safe. They are all approved for emergency use, and there are proper steps in doing the vaccination. They will be screened for incidence of allergies to vaccines and any other comorbidities. The systems are in place for the safe vaccination of pregnant women and also for those who are already breastfeeding women.
It is indeed breastfeeding, which is the best source of nutrition, by the way, for infants. And there are so many benefits of breastfeeding. Dr. Irene, let's discuss some of those, yung mga importanteng benepisyo ng pagbe-breastfeed ng mami sa bata.
Yeah. Number one, it assures an immediate bonding for the mother and the baby, especially we are practicing the essential newborn and intrapartum care wherein we do not separate the baby from the mom, delayed cord clamping, and skin-to-skin contact. So the baby can have a boost in his or her immune response. Antibodies from the mommy can be transferred to the baby via breastfeeding. They said that the baby has less incidence of the sudden infant death syndrome, and the mommy can lose her pregnancy weight gain sooner. It can give other protection to the baby.
Okay. Now, really quickly, Dr. Nonette naman, kapag yung mga mother, for one reason or another, hindi sila maka-breastfeed, anong mga options ang maganda para sa kanila?
Another option is through the milk bank. There are actually breast milk donors available in most hospitals that underwent proper screening for any possible infections. The next option, if not other mothers' breast milk, is through formula milk, which will be prescribed by their pediatrician.
Postpartum care is a time of healing and adjustment for mothers. More on this when we come back. Your healing is our mission here on the program. You're watching Med Talk Health Talk right here on CNN Philippines. Caring for your newborn becomes the ultimate focus of most parents, but postpartum care for a mother is equally important. I'm Dr. Freddy Gomez. You're watching Med Talk Health Talk on CNN Philippines, where your care always comes first. Pregnancy changes your body in many ways, and it doesn't stop when the baby's born. Dr. Nonette, what are some of these changes and how can one respond or adjust after a baby is born?
Okay, so the most common change would be the increase in your breast size because of the increase in milk production. We just have to educate our patients or our breastfeeding moms on the proper care for their breast to avoid any breast infections. Second most common would be the weight loss or the excessive weight gain accumulated throughout the pregnancy. So usually we advise them that there would be at least 2 kilograms weight retention postpartum, but we just have to reassure them that proper exercise and diet can make them go back to their normal weight in a matter of 6 weeks' time.
I have a question for Dr. Irene. What are some of the tips that you can give mothers on how to stay healthy while yung katawan nila ay nag-heal pa or nagre-recover from childbirth?
All right. There's this thing we call the fourth trimester. That's the postpartum period wherein the concerns of the mommy, the physical need, the social, psychological need of the mommy should be addressed. As to the physical need, slowly, the postpartum period can last for 3 to 6 weeks. So slowly, she can go back to her usual activities. But of course, her concerns like weight gain, the pain, especially if she had the cesarean section, or even if normal delivery, she will experience pain and some of the feeling overwhelmed, feeling tired, and there's lack of sleep. So this should be addressed.
After giving birth, you can feel a mix of emotions from excitement and happiness to fear and maybe even anxiety. And sometimes it can even lead to what's called postpartum depression. Dr. Irene, why does this happen, by the way? And what are some of the symptoms of postpartum depression that our viewers should look out for?
Postpartum depression can actually begin beginning at 2 to 3 days postpartum until about 2 weeks, and it can still last longer than that, maybe even a year. But we need to observe for the signs and symptoms of postpartum depression. It will start as the postpartum blues, or the mommy can have crying spells, anxiety, loss of appetite, because there's an interplay of mixed emotions of being excited and joyful for the new baby, and at the same time being fearful or anxious of the responsibility of caring for the baby. And also, this is due to the interplay of hormones during pregnancy and postpartum.
Now, some mothers may find it difficult to admit that they're depressed even after their baby's birth. But if it isn't treated or addressed, it can affect the whole family and even make it hard to bond with the baby. Dr. Irene, when should one see a doctor about this? And is it also possible for the father to have postpartum depression as well?
Yes. The 2 to 3 days to 2 weeks period is still manageable to just give her the family support and assurance that she can cope with the childbirth and with the new baby. But when the symptoms becomes intense or it's prolonged, that's the time that she needs to talk to her obstetrician also, because there might be harm that she can inflict to herself and to her baby. Usually this postpartum depression for the fathers happen in young fathers, those who have a previous history of mental health issues, those who have financial challenges, and so they will experience the same, the crying spells, feeling sad, insomnia, irritability.
There you have it. We hope today's episode gave you a healthy start to your pregnancy and beyond. Thank you for joining us, perinatologist Dr. Nonette Jiansuy and obstetrician and gynecologist Dr. Irene Sige. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez. This is Med Talk Health Talk on CNN Philippines.